My dad wanted to ask you some questions about procedures that you do at your work.
Okay.
Well, I think Jerry had the first question. This is Jerry O'Connell. You had the question about penis enlargement.
Do you do penis enlargement?
Yeah, I did. Hi, how are you? I was saying it as a joke, but now here we are. It's happening.
Listen.
What is that process? I mean, not for me. If, like, I have a buddy, Alex, who's thinking about it.
So it's called a fat grafting. It's a fat transfer. So they'll do a liposuction, and from transferring the fat after the liposuction, they put it in the penis, and then also they can add a filler to the tip to make it grow like the length a little bit bigger, and then the girth a little bit more girthy.
Yeah, I feel like this sounds like you're just getting a fatter penis, not necessarily a longer.
It's like, yeah, it's kind of like fatter, but they can also make it a little bit longer. And then there's a thing called Scrotox. A lot of men want saggier balls, so they'll get Botox in their scrotum too.
But how do you know, like, once you put Botox in your scrotum, how can you tell if somebody's actually happy?
If they're wearing really short shorts, then they're like hanging low.
Yeah. Yeah.
And what do you do with the vagina? What do you do with the vagina?
What is vagina rejuvenation? They wanted to know.
So we do vaginal rejuvenation. And
This is for Al. You're talking to Ali now. Ali was interested.
Hi, Ali.
Hi.
Well, there's invasive and non-invasive. So
You
Dr.
want
David
invasive, right?
I want pretty invasive.
Yeah, Dr. David Matlock specializes. He's like one of the
Can you
founding
imagine?
Matlock,
Matlock.
CK or CH?
Matlock,
Yeah.
like the show.
Yeah, he's pretty famous for vaginas.
And is there like a BOGO deal for both holes, like a buy one get one half off situation?
You know, that sounds like a Groupon thing to me. I don't know if Dr. Matlock does that kind of stuff. I don't
Maybe
know if you're
2
gonna
holes, 1
find
stone.
that.
You know?
He's a real deal. I don't think he gives a lot of discounts unless
How
you
much
wanna,
does it cost?
Go public with it. I don't know if he does that. I have no idea. I bet you it's probably around, depending if you want like other things done too.
Like what?
I have no idea. I don't do the price. I'm guessing around $100,000. I don't know.
That's crazy.
I have no idea. I don't quote
It's
me
an
on
investment,
that.
though. I mean,
Could I start a GoFundMe? Help me get my...
No, but what is vaginal rejuvenation? What is it?
That'll put me in the hole.
So the invasive it's a surgical procedure. Well, patient goes to sleep and we put
There you go, Ali.
legs in lithotomy, legs and straps.
Could I guarantee that there is a female nurse in the room the whole time observing?
it's
my
Alex
son.
filming
My
it.
son shooting.
Yeah.
Yeah, no, I could be there. There's other nurses too that are in the procedure room. But there are women, I think, that want to go twilight. So you're like in and out. So you're not going to feel any of the pain. There's a block. So they'll put like a local anesthetic in there. So you're not feeling so much of the pain.
But what do you do?
And-
Talk about what you do.
So imagine like a
Put some music behind
sleeve, you know, like an arm sleeve or a cuff, and making it tighter. So you're taking away tissue along the end from inside out, and then some of the vaginal labia looks like beef curtains, if you can imagine beef curtains.
Yeah, now I'm getting hungry.
They kind of just cut away from that and then discard it, and it looks really nice from the inside out.
Can I get it done Mike's way?
Can you get what?
Well, you're talking about the beef curtains. I'm just wondering if I can get it Mike's way with oil, peppers, lettuce, tomato, onion.
Yeah, when it's cut off, it looks like a piece of steak, honestly.
Yeah.
Have you ever made that mistake?
No, there's no eating allowed in the OR, so I never made that mistake.
All right. Well, it sounds like you got some school stuff there. I hear the kids in the background. We may have to get back to that. Thank you so
I'm
much. This has
hiding
been
behind
really.
a dumpster right now.
Yeah. This has been informative. That's not where you perform the
literally-
procedures, though, right? Dr. Matlock does not perform them at a dumpster. Although there is a discount
I'm
if
hiding
you do it
behind a
inside of the
dumpster, so
dumpster.
no
Very
kids
clean
are
dumpster, though.
are hearing this.
Not
Do you
one of
guys
those dirty ones.
do you guys do later in life circumcisions?
Yeah.
I'm asking
we
for a
have
friend
a
named
lot of
Jerry.
urologists that do that.
Yeah.
Really?
We also, we see hydrocell. It's like when these guys come in with like huge, like it looks like an infection of the scrotum.
I'm so sorry.
And-
Does Dr. Matlock do that, or does a Moyle come in and do it?
No, so now we have urologists that specialize in that.
Wait,
So
how many
that's
guys are coming in with
different.
infected scrotums? Why is that happening?
It happens, Howie.
It's
Chill
kinda
out.
wiping.
Like,
It's
don't be so
a very random
judgmental.
thing that happens where there's a lot of fluid built up.
And they're wiping back
and
to
they need to get
front.
it drained.
You can blow that this
Huh?
way.
And they're wiping back to front. The poop is getting in their sack.
Yeah, gotta go front to back.
Yeah, we keep it pretty sterile.
It's
No, we're
important.
not talking about they don't shit when they get there. She's talking about that's why they're,
Oh, like how it happened?
yeah.
Oh, okay. Yeah, no, I need to read up on it. I think it may be just like a
Freebie.
random thing that happens to men sometimes.
Never heard of that.
Anything else you want to ask Natasha?
Yeah.
Yeah.
Do you bedazzle?
Could I send a photo? Could I send a photo in case you want to use it as like this is what it could look like the optimal vagina?
Oh.
Like, you want to be the after photo?
Yeah, like I just kind of want the doctor to look and be like, that's really nice.
If
Can I-
you want to come into the clinic, and then he can give you a consult and add you to his album.
You
Okay.
have an album?
Yeah.
It's a coffee table book.
Nameless. Completely nameless.
I just like a
Unless you want
second
to put your
opinion.
your face on there too.
She
Oh.
doesn't have to come into the office. My son is here, and he could photograph.
Got it. Film it all. Post it. YouTube.
Alex.
Pal.
We'll do a GoPro, get inside too.
Yeah.
We have a pelvic floor tightening machine too that's non-invasive. So there are other options if you don't want to do surgical. We have non-surgical.
How do you tighten without?
Kegels.
There's
I do
pros
Kegel
and there's,
exercises.
Like, the Morpheus for the face? They have it for the vagina now too.
I don't know what that is.
What's for the face?
Morpheus?
Micro needling with radio frequency.
Oh, I
Oh.
do not want my coochie micro needled.
Yeah.
No, I'm doing Kegels.
Yeah.
Do you do Kegel exercises?
No, but I have family members who do that, who go get facials and they have issues with acne and they get microneedled. It really is helpful.
You should do Kegel exercises. The summer's coming.
Can I let Natasha go?
Yeah, I do
Okay.
it because
Bye,
I'm getting a.
Natasha.
See you,
Bye,
Natasha.
Natasha.
Thanks
Bye,
so
Natasha.
much.
You're welcome.
Thank
My
you so
son just
much.
started. This is perfect timing.
Okay.
We're perfect. I do Kegel exercises, and I'm getting a 6-sack.